The Family Planning Association of India, FPAI, Nagaland branch celebrated its 75th anniversary on Tuesday, July 24, 2024 at Muskan Youth Centre in Kohima. The program included a brief report from Vincent Bello, the General Manager of FPAI Nagaland branch, and an acknowledgement of the organization's 75 years of service. Other participants included 1. Dr. Konyak, Chief Medical Officer of Kohima, who gave a special guest address. 2. Wingazanyo Khatso, Program Officer, who delivered an ASRHIE in the humanitarian setting. 3. Alenuo Kelio, Youth Volunteer, BSc, who served as the program's compare. 4. Atsibu Usu, Youth Volunteer, BSc, who gave the welcome address. 5. Tejavaizo Kir, Chairperson, BSc, who led the program. And 6. Punasongla Jamir, Councillor, who proposed the vote of thanks.
First of all, I would like to give honor and glory to God for granting us such a wonderful day to celebrate 75th anniversary of Family Planning Association of India. On this auspicious occasion and celebration, I take this opportunity to salute the pioneers of this association, both national and state level. Family Planning Association of India was formed by recognizing that having too many children and repeated pregnancies become detrimental to women's health. Therefore, a group of concerned intellectual women decided to address the issues, which was resulted in the establishment of Family Planning Association of India in 1949 and affiliated to the International Planned Parenthood Federation. Family Planning Association of India is a voluntary, non-governmental organization which was established and pioneered the family planning movement in India. The association worked on a wide range of sexual and reproductive health and rights issues, encompassing family planning, maternal health, child survival, HIV AIDS, safe abortion, reproductive tract cancer screening and prevention, gender empowerment, and young people, and mitigation of gender-based violence. The key strategy of Family Planning Association of India includes ensuring access to high-quality sexual reproductive health services and strengthening access to information and service to young people. Comprehensive sexuality, education and capacity building of health care providers and community volunteers on sexual and reproductive health issues, engaging with communities and individuals to change gender disparity and promote sexual and reproductive health and rights, providing livelihood opportunities for economic empowerment of the poor and vulnerable, and advocacy for policy change at the national and state level. Some of the most important benefits of the family planning, if implemented effectively, are now visible in preventing pregnancies-related health risks in women, reduction or reducing infant mortality, reducing maternal mortality, helping to prevent HIV and AIDS, empowering people and enhancing education, reducing adolescents' pregnancies, improve quality of life, slowing population growth. These are some of the most important positive impact that if we can continue this family planning service effectively. On this historic and remarkable day of Platinum Jubilee of Family Planning Association of India, I sincerely congratulate and thanks to the association for empowering people, for transforming gender norms and power dynamics to promote gender equality, reduce gender-based violence, and improve the economic status of women and other vulnerable groups through their tireless effort and valuable family planning service rendered to the people of Nagaland. As the association celebrates those momentous milestones of 75 years of existence, it can be said that it is not only a milestone for the association, but also for the state of Nagaland. As we celebrate this joyous occasion, we must also take the opportunity to retrospect, to be inspired by the achievement made so far, and look forward with a renewed vision and plan. May the association continue to grow from strength to strength and excel in the service of humanity. Thank you and God bless.
So celebrating glorious 75 years. Here, as you will already know with the brief that leaflets that we have given, established in the year 1949 to promote family planning, and evolved as a national voluntary organization working for sexual reproductive health and rights. Unsafe abortions averted 122,191. Then maternal deaths averted 10,058. Then 1,611 maternal and child deaths averted. Nagaland branch was established in the year 1977, 29 January. So that's the time when we should be celebrating and partying and dancing as well. So we'll have to start thinking of that line as well. 2nd December 1976. My memory is helping me now. 2nd December 1976, Mr. S.P. Sinha, I remember him, his behavior. I don't remember his face now, but my other colleagues, they are smiling. He was key in the, thinking of the need to start a family welfare program. And Mr. S.P. Sinha initiated, and they discussed the things. 1977, they had a meeting, and under the chairmanship or presidentship, then we used to have presidentship of Dr. L.M. Murray. Dr. L.M. Murray, Family Planning Association of India, Nagaland branch, came into existence.
Continue to support us. We will also continue your footsteps. If you support us now, in future, we will grow one day, surely. We will grow and continue your footsteps. Because I decided 3 years back, I want to take this platform in the international level. I want to take this platform. So I didn't talk with Sir also. I took a break myself. And I started taking software engineering. I started learning about all those stuff because I myself told myself, I want this platform to be, for every Aminio out there. Maybe someone is there who is, crying inside but no help. So I want to develop something using the power of social media. So right now I'm striving for that, and I'm also trying to, make apps and website and all those, right? So that we will bring closer and more people to our own community. Because the reason I never shared with sir regarding this, why I suddenly took a break and all those was because what if I don't achieve it in the process? What if right now I'm saying I want to be a super engineer, I want to achieve this, that for top X, etc. But what if I don't achieve? Will that hit me back? That's what I was saying. That fear, I was holding it within sir and I never shared with him. But he told me indirectly when he called me for a meeting, he told me like, you need to be open up, don't be scared of anything. You are like tripping yourself far away from how far you've come. Huh? So I left all my music career, I left everything, and I started studying with my sole purpose, that is to help this platform which brought me up this timeline. So that was what I decided 3 years back. And now I'm in my final year project, doing my project. I also received an award for IoT internship, the whole National Institute of Electronics and Technology. I received different kinds, but I'm keeping all those aside and still striving to learn more about software, technical, and going on without, putting myself down from the words of what my friends and family are saying. So likewise, I want to encourage my dear seniors and elders, please don't look down on any of the stage, like be it small or big. Please continue to support us. We will also grow up one day, and then we will also move on forward like that. So with this, I'd like to thank Sir very sincerely. You molded my life. I'm very sorry, I'm so emotional. I never cry. I always say, Batman, don't cry. So, I'm a tough lady thing, but today, don't make fun of me. So, and with that, I'm so emotional. I'm thrilled with how far we've come and how far we will achieve again very soon. I leave it all to God, and then with our team, let's hope that we go forward and continue the zeal and the power so that we may achieve more in the future.
Reproductive health, delivery in emergency settings. So this training was mainly focused on how to be better prepared using the base objectives, focusing on adolescent sexual reproductive health. So why there's the need to focus on adolescent sexual reproductive health? Because although adolescents make up a large proportion of the population, when you look at humanitarian crisis, it is said that their sexual reproductive health needs are hardly unmet. 1/3 of women give birth before the age of 20 years, and delivering with a total delivery of women under before the age of 20 annually, with delivery of with 1/3 of women worldwide give birth before they reach the age of 20, and annually around 15 million adolescents give birth before they reach the age of 20. 5 million adolescents are said to have unsafe abortions, of which 70,000 are related to abortion deaths. Half of new HIV infections are found around the ages of 15 to 24 years, and 1/3 of new STI cases are found among the ages of 25 and below. So in order to be better prepared, we can apply this ASRHIE base objectives. These are the 6+1 objectives. The first objective is ensure the health clusters and identifies the organization to meet the needs for SRH. So when we talk about this, we can never work alone, and it's important to collaborate. Collaboration can be done through with the help of DDMAs, health clusters, NGOs, and even communities. By working together, we can identify the gaps, the challenges, and how we can tackle it. But in order to be better prepared, we need to have proper resources. So in order to have proper resources, we need to have secure funds. Secure funds can be through the government or even through NGOs. When you look at adolescents, in terms of emergencies, especially adolescent girls are more prone towards vulnerable towards rape and sexual exploitation. For adolescents who are sexually active, in terms of crisis, they may not have access to family planning services as well as sexual reproductive services. So in such cases, they are more likely to practice unprotected sex, further leading to more HIV as well as STI and unwanted pregnancies. So or in some cases, adolescents might even be separated from their families. So like they are more vulnerable to sexual exploitation. Hence, in such cases, because of their limited life experience, they might not understand the nature of abuse as well as exploitation. And in order to meet their family needs, they might resort to selling sex in order to meet their family needs. So in order to avoid such scenarios, we can apply these following objectives. The second objective is on prevent sexual violence and respond to the needs of survivors. Engagement of communities. When we talk about engagement of communities, when we look at the society, they usually tend to be judgmental. So, with the help of communities, by educating them and bringing awareness, we can reduce stigmatization as well as discrimination. We can ensure a safe space, making sure that we can ensure a safe space, making sure that the adolescents feel safe, and making sure that keeping in mind the volunteers should keep in mind that they're working with adolescents and maintain their privacy as well as confidentiality. Psychosocial input should also be encouraged in order to help survivors respond or cope up with their trauma as well as rebuild their self-worth as well as sense of security. The next objective is prevent and reduce morbidity and mortality due to HIV and STI. In order to reduce HIV and STI, we can encourage early testing, promote counseling services, as well as access to condom, as well as promote PrEP and PrEP, making sure that adolescents know about the access for PrEP services. Prevent excess maternal and newborn morbidity and mortality. When we look at adolescents, it is said that the leading cause of death among adolescents is said to be abortion. Is said to be due to pregnancy, during delivery, or even abortions. In order to prevent these, we can, when we look at health providers, we have to. We can encourage clean delivery packages. Of course, health facilities should be encouraged, but in cases of crisis, in order to be better prepared, we can provide clean delivery packages so that they can be used in terms of delivery at your health facility or even at your homes. By working with community leaders, we can identify the pregnant women as well as help them refer to the nearest linkages available. Remote services also should be available 24/7 so that in case of any emergency, it can be treated without delay. In order to prevent unwanted pregnancies, we can provide family counseling services and different contraceptive methods. Ensure safe abortion care. It is estimated that 3.2 million adolescents have unsafe abortions performed by unskilled person or in an environment where the medical standards are not properly met. So in order to prevent this, we can provide access to information about abortion procedures, risks, and the services. We must make sure that the trained providers are well trained and competent and provide and perform this in a safe and hygienic facility. Thank you. That will be all for my part.